Good evening, Shamar. Leah, what happened to you? Tammy, good evening to you. Glenda, hello. Happy Friday to you. I'm going to put my glasses on. Well, I can't even see what's going on here. Mimi, good evening. Good to see you. Vera, hello. Tawana, hey, Tawana, how you doing? I'm just waiting for my own feed to come up. Shaman, hey, Kickback, what's going on, man? Lady Sheila Odom, how are you? Bernadette, good evening. Good to see you as well. Anissa, hello. Mint, good evening to you. Millette, hello. Dion, good to see you. Christina, happy Friday. Thank you so much for joining us. Roxy, hello. You can explain. Okay. Jay, good evening. Millette, hello. B. Lynn Roberts, good evening to you. Good evening to you, Bishop Sills. Thank you for joining us. Andrea, thank you for watching. Good evening to you. Hello. Samantha, hello. Thank you for watching. Shakira, good evening to you. Good to see Nicole on. Brother Angelo Bosco, good evening to you. Thank you for joining us. Leomia, good to see you. Carrie, hello. Good evening. John, how you doing? Charles, good evening to you. Hello. Linda, hello. My child, Amber, hello. It is good to be seen. It is good to be seen anywhere. That's certainly not good to be viewed. Denise, Debbie, hello. Imelda, hello to you. Good evening. Good to see you on. Thank you for joining us. Pastor Roche, hello, sir. I am doing well. Brenda, hello. It is Friday. Thank God it is Friday. Kathleen, hello. You have a new tee for me. Yeah, you owe me t-shirts from like last year. I need my shirts. Sharon Renee, hello. Paula Council, hello. Good evening, Nisi. Good to see you. Dr. Hart, hello. Norma, hello. Janelle, hello. Uncle Greg, thank you so much for joining us all the way from Texas. Hope things are going well for you. I'm trying to... All right, there we go. We're getting a little better now. Good day to you. Thank you. Angela and Paula. Tina, I hope you're being safe up there in New York. Thank you for your service. Amy, yes, thank God it is Friday. Christina, hello. The Honorable Jean Harley, good evening. Demetria, hello. Nikki, thank you. And let everybody say happy birthday to Dawn Baker. Yesterday was her birthday. And everybody knows how much Dawn Baker does for everybody in this community. And I'm glad to call her friend. So happy birthday, Dawn. Cora, hello. Ron, hello. Good to see you on. And Faye and Latasha. Naughty, what's happening, my brother? Good to see you. Mama Frankie, good to see you. Loto, hello. Tamika, hello, good to see you. Angela, you got my shirt? I don't have my shirt. I need my shirt. Reggie, good evening to you. Let's see who else. Hello, Sarah. Pastor Osborne, thank you for joining us. I'm here. I'm still here, you know, knocking it out. I'm still knocking it out. So we're doing good. Yeah, thank y'all for shouting Dawn out. Molly, good evening. How you doing? Good to see you. And I'm trying to get all of this coordinated. I'm trying to make y'all not mess it up tonight. Miss Lynn, good to see you. Cree, good evening to you. We'll start momentarily. Nyla, good to see you. And Renee, yes, we are looking forward to getting back to normal safely. Sandra Lynette, good to see you. Tanya, thank you We appreciate that. My feed is freezing. Yeah, I see that. I hope y'all didn't break the thing again. According to this, it's okay. We'll see how it goes. I hope y'all didn't break the thing again. But we'll see. Have I frozen? Okay, I'm being told my feed is freezing. I'm hoping that it's not. Let's see. Okay. So, I hope we're okay. Cheryl, good to see you. Christy, hello. Tanis, thank you for wishing Dawn a happy birthday. Trinia, thank you. Debbie, thank you so much. I appreciate that as well. Hello, Tanja, thank you. Good evening to you. Thank you for joining us as well. So let's go ahead and let's get started. Sharon, thank you. Good to see you. Landmark, Greg, thank you. So let's get into this. It's Friday. Jacqueline, good to see you. So here we are. And Grace, hello. I hope all of you have your Easter costumes. You all have it on. Today, I'm wearing this. And actually, this is actually made for me, and it's really very nice fabric. Came from Benin. Thank you so much for this. I appreciate that. Help keep us safe. I hope all of you have some type of face covering as we navigate and continue to navigate around our community. So, as of today, this evening, we have in our county over 339 confirmed cases of COVID-19. In Bryan County, 31 cases, Camden, 27, Effingham, 25 cases, Glenn, 46 cases, Liberty, 31 cases, Long, 2 cases, McIntosh, 2 cases. And in Chatham County, at this point, we have 173 cases, and we have still 5 deaths. Again, I believe there's more than 5. But we have 173 cases, and we went up 14 cases in just 24 hours. 24 hours ago, we were at 160, and we are now at 173. So pretty big jump for us today. Again, this is to be expected. As we do more testing, we expect that there's going to be more results. Now, I wanted to send out a quick shout out today. Today's shout out, and I've been shouting out as many occupational categories as I can. And again, I know people get mad because I can't call out everybody every single time. But I do want to take an opportunity to recognize people who are doing the great work in our community. And again, I didn't shout you out today, but I guess I'll shout you out next time. Promise you I will. Today I want to shout out emergency communications dispatchers or emergency communication operators. Now they work for Chatham County, but these are people that every day for them is an emergency. People never call 911 to say that things are going well. So when people call 911, they're calling because something is wrong. And so can you imagine people who internalize all of that? You know, they're behind a phone, they're hearing frustration in people's voices, they're hearing pain in people's voices. Sometimes they're hearing the gunshots. The ShotSpotter program is within their facility. They're hearing all of that. And so they internalize that. And so not just for what we're going through now, but it's because of emergency communication operators and dispatchers that our first responders, police, fire, EMS, are able to get where they need to be. So today's shout out goes out to emergency communications dispatchers. Congratulations. Thank you all for all that you do for us. And just wanted to send that thank you out there. So Someone just said they are the lifeline. They are literally a lifeline. So if you know an emergency communications dispatcher, tell them thank you. Thank them for what they do. Thank them for what they contribute to our community and how they keep us safe. So a couple of things I want to talk about, and then we will move on. So just want to let you know that the Georgia Department of Public Health is expanding access to COVID-19 testing. So as of next week, anybody with symptoms is now eligible to be tested. You still need a referral before heading to a testing site. So there are two ways that you can be approved by a test. You can contact the health department, and they will screen you over the phone. And if you are eligible, they will send you to be tested. The other way is your regular healthcare provider, your doctor, your nurse practitioner can still refer you to a COVID test. So that's good news that we now have two ways to get a test. One through your health department, the other one through your healthcare provider. And so we want to make sure now you have to have symptoms now. You can't just say, I think I might have it. I just want to know whether I have it. No, you have to actually, are y'all hustling mask on my page? Laura, you're asking me the same question. Laura, I don't know how many cases require hospitalization. The health department, I don't know. I mean, that's information they have not given us. So, but anyway, so two ways you can get tests. One through the health department. You can call them. They will screen you over the phone. And then the second way is you can call your healthcare provider and you can be referred to for a COVID-19 test. And then they will send you there. And so we're excited about that. So that was the first thing I wanted to talk about. The other thing I really wanted to talk about today was really about social distancing. Most people are getting it. I'm out in the community and I see people out trying to get the point. They're out there. They have their mask, making it happen. And the funny part about it is that sometimes you don't even recognize folk. Walked by a really good friend of mine. I didn't realize. It was like, oh, okay, well, I didn't realize it. So, but some people are still not getting the point. And I want to make sure that we're absolutely clear. Again, we're still in the middle of a pandemic. I mean, people think that, sneaking and, we're going to have this, we're going to have that. I mean, you're not fooling anybody but yourself, because everybody knows people have come to your parties and your gatherings and they're sending me pictures saying, I don't think this is safe. So, please, you're not fooling anybody by that. Businesses that are, taking appointments through the back door and you're locked and stuff. Again, people know what you're doing. They're telling us. Again, you're not fooling anybody but yourself. You're not hurting anybody but yourself and those who you say you care about. So your customer gets really, really nice looking hair, but then they get COVID from you. I mean, that doesn't mean you really care about them. That's just my opinion about that. We have to continue to be smart about this. Again, I know that this is still very, very hard times for us, and people are still struggling. Right now, we did ask Dr. Lawton Davis, who is with the Coastal Health District. We wanted some more specific numbers as it related to COVID-19 in Chatham County. So we know right now we have 174 cases. We realize, and right now we're split racially, about 50% African American, about 50% Caucasian. This does not follow the norm as the rest of the country. That right now women are slightly higher infected than men. Women are 55% of the cases. Men are approximately 45% of the cases. We also know that in our coastal health district that The youngest person confirmed at this point is 2 years old, and the oldest person confirmed at this point is 91 years old. So again, it runs the gamut, and we're trying to get more specific information as it relates to zip codes, because we realize that we want to make sure we're able to know exactly where things are going, where the infections are occurring, so that we can make sure that we're concentrating our efforts as it relates to that. So I wanted to make sure you all were aware of that. And then finally, and then we'll take some questions, is that, as you know, there's been a lot of talk from President Trump and then from governors across the country about reopening. And they've put out an elaborate plan about how this happens. My only thing is, and I want us to get back to some reasonable standard of normal that we can. But for me, I do not want us to rush this. And I don't understand how, for me, that you could have any type of formula for Washington, D.C., for this country. Savannah is different than anywhere else. We need to have a plan that works for us. Even those in Georgia, from the Atlanta area is different than us. The Dougherty County, Albany area is different than us. We have to have a plan, in my opinion, that fits us. I do not want to rush this out, because to me, it's just like someone who walks out the hospital AMA, against medical advice. Hey, I'm going, I'm out of here, I'm tired of the hospital, I leave, and then they get sick and have to come back even worse than what they were. We have to ride this out until the science says that it's safe for us to at least phase back into opening businesses up. I just think that we have to be smart about this. We can't rush back into things, because if we have an outbreak, we can put ourselves back in a situation very, very quickly where we now have outbreaks that cripple us for much longer than what we're talking about. So for me, my approach is cautious. Again, I want to follow the data. The data says at this point that Savannah, Chatham County, the Coastal Health District has not plateaued as of yet. We're up there, and even when you go to the top of a hill, you still got to come down the hill. So although I think that people have to make sure that what we're doing is based on some empirical scientific data that says that not only we plateaued, but we're at the point at which it's time to start opening and reopening our economy and getting people back in. Because you can open up businesses as quickly as you want to. If people don't feel safe, people are not coming to the businesses. They're not going to come. They're just not going to come. I wouldn't come. You want to come when it's safe to do so. You don't walk into a building that, although you don't see any fire, is still smoking. And that is how I characterize our situation. We'll come in and we'll do the best we can to make sure that we have taken care of what we need to take care of. But to me, we can't talk about reopening our communities, our businesses, until we have widespread testing. Because right now, we don't know what we have. With a 2-week time spread in between infection and becoming symptomatic, for us, we have to be responsible enough to recognize that we have to make sure that we're able to test to make sure this is passed. And we don't know that without having widespread testing. Here, we're just opening up a second way of people being tested. So until we can test people in masses, until we can get back results in a very quick way across our community, that is the only way we're going to know where we stand as it relates to that. And until we know where we stand, to me, it's really irresponsible to too quickly open up things. So, that's kind of where I am about it. And so my position about this will be just that. As far as I'm concerned, for the city of Savannah, or for those for our employees, we will do social distancing until it's safe not to do social distancing anymore, because we have to protect people. That's what we have to do. I mean, we have to make some hard decisions between the lives of people and the economies of people. And I know sometimes they're tied, but at this point, we're in a life or death situation. And again, look anywhere you want to look at it as relates to that. So the other news, I think I saw Dr. Hoskins on from the school board, and Dr. Levette usually joins us. They've announced what their graduation plans. Just I want to thank them. I mean, this was hard. I mean, could you imagine? I still remember my high school graduation. I remember it. It wasn't all that long ago, but I remember my graduation day. I remember the preparations coming up to the day where I crossed over that proverbial bridge from being a kid to being a man, and that was my high school graduation. I remember that, and it was something that sticks with me for really all of my life, and I'm sure for many of you, these were things that also stuck with you throughout your entire life. And so could you imagine what it feels like from no fault of your own, to be able to now be in a position where that does not happen? But again, I think, it was wise not to have all of these young people together. The governor certainly made that call, and we abide by it. And I think that the superintendent and the school board did the best they could to manage in a really bad situation. I mean, there is no way, and I've had people contact me and I've told them, again, I don't have anything to do with the school board, except they're all my kids too. But I think for us, we have to keep people safe, and so we have to come up with a solution, and I think they have come up with a solution that is able to not only recognize young people for the magnificent achievements that they've done, but then also to be able to keep people safe in this. So they've announced what their plans are, and so we certainly will ask you to support their plans and support what they have considered in terms of making sure that our young people remain safe. And then, let's find ways in the community, let's find ways through social media to make sure that we are recognizing these young people for this wonderful achievement. And, we're going to be excited for them, and we're going to lift them up. And, so I just thank them for really making some really hard decisions. I mean, it's really a hard decision. I mean, what do you do? And I've heard people complaining, and they're, well, this and this and this and this and this and this. I mean, but you don't have any ideas yourself. I mean, what do you do? You're under a stay-at-home order. What do you do? We can't fill the civic. As a matter of fact, I will not allow the civic center to be used to put a bunch of people in there who won't be observing social distancing. You know what we do. Every year they say, be nice, don't yell out anybody's names. What do y'all do? Yell out people's names. Every year, almost every graduation I go to, somebody gonna pull out the air horn. You know they're gonna do it. Because people just get excited. And so, there'll be somebody who'll be trying to break the rules, even in this. So, they gotta do the best they can. So, it does not negate the achievement. It does not negate the magnificent things that they have been able to do to have graduated from high school, which is a wonderful thing in our community. And we will love them, we will lift them up, and we will celebrate them. And when this is over, I'm sure families will do the best they can to make it up to them. And that's all we can do. Find ways to make it up to them. So I think that was it for me today. wanted you to do a couple of things. I'll answer some questions. I wanted you to like my page. You liking this page, Van Johnson? Go ahead and like it, so that when we send out these updates, you'll get them. And then share it. So I want you to share it, so people can hear what's going on here in Savannah. And tomorrow I'll be doing another update, as I do on Saturday mornings as well. So you'll hear about what else we're going. We're doing some great things with our homeless population, and I feel grateful that we're in a position now to be able to do that and get the federal government to help pay for it. So we're excited about that. Also, stimulus checks. Let's talk about stimulus checks. So for those of you that are blessed to get stimulus checks, remember what a stimulus check is for. Pay your bills. Act responsibly. Now, I just happen to be at Walmart. Had to get some groceries, but you know, there are a lot of TVs going off those shelves. A lot of them. I mean, I'm just hoping that we're using them for what they were purposed for. Pay some of these bills. Let's make sure that we're, you know, being responsible with that. So that's all I gotta say about that. So here we go. Nia says, I have no problem complying to live for me and people I come in contact with and family members. Nia, thank you for that. Let's see. I'm trying to see what else we... I'm trying to just see some of the comments and see if there are any questions I can answer. Martell says, yes, high school graduation is so important. Love your class and classmates. Candace, that solution sucks. I'm sorry. I mean, if you have a better one, I'm sure Dr. Levette knows we need to have it. But again, you know, it's the best they could given the law that is in place. The law that is in place. The law is social distancing. So, you know, sorry. Please address the public calling 911 about this. This is non-emergency number handles that. I don't know what you're talking about. April, just let me know. It's too early to open up. Zakisha. All right. Shiloh, your son as well. It sucks. So thankful St. Patrick's Day prayer was canceled. People be sensitive and stay home. Thank you, Deborah. I appreciate that as well. Good to see the boss chick on. And let's see. Hey, oh, Dr. Vet is here. Thank you. And you know what? And what I'm willing to do. Wait, hold on, Dr. Levette. Pat says, open up the nail salons and hair salons. Your wife's roots done come back and them toes crusty. Well, Patrick, my friend, you need to learn how to, I think that'd be a wonderful thing for you to give your wife a pedicure and for you to learn how to do, get her roots back to the color they were supposed to be. I think that's really cool. Figure it out. Michelle Martin says, can they have a graduation at the end of summer? And Dr. Levette, if you hear that, I mean, I would think by the end of summer, young people are already gone to what their next chapter is. So I don't know how that works out. But what I'm willing to do for me is I'm willing to do a live and we can shout out every single senior. And I'll sit here and we can shout out every senior for this school. I mean, we could do that and, you know, we can all, again, be very happy for them as well. You don't care what nobody says. Van got a personal barber. Persephone, I do not have a personal barber. I mean, this is not, hard to do. I have a clipper and I got a mirror and I just go ahead and this is what I do. And, you know, get the line and just do that. I mean, that's the blessing of having no hair. So, Carrie, thank you very much. Miss Toya, yeah, this is lemon flavor water. This is actually very, very good. Um, he's too worried about making Trump happy. I don't know what that means. Miss Beatrice, God bless you too. Um, hey Jackie, good to see you. We're hoping to have you back going soon. Kathleen, thank you so much. I appreciate that. Cheryl, God bless you as well. Sharon, thank you. Again, we're doing the best we can. Katrina says if you use herbal essence, you can help get your wife right. And I hope your wife don't hear this because you may be put out the house. Rita, thank you so much. Yeah, Latrina, I feel the same way. I'm going to be social distancing until it's safe. I mean, if y'all don't care about your life, I care about mine. Christina, thank you very much for us on Wilmington Island. Well, thank you so much. Alonzo, I don't know. The governor has closed the bar, so we don't know about that. Kiara, I don't know what's happening with the inmates. Go to Sheriff John Wiltshire's page. He's been very open about saying what's going on at the jail. Thank you, Darren. Thank you. Kimberly, thank you. Priscilla, thank you. Can I hold graduation and prom later? Again, I think we've asked that from Dr. Levette. I think there are some issues, scheduling issues with that. Talk about filing unemployment. Okay, I will talk about that in just a minute. How's it going to be for the teachers that shut down the classrooms? I don't know. Frenchie, what zip codes do I have? I don't have zip codes yet. I'm asking for them. April says they call about social distancing. They call 911 about that. Okay. So that's what that's about. Arnie, thank you so much. Appreciate that. Alonzo, Tanya, thank you. Kevin, Kevin, I cut my own hair. Latasha, thank you. Shouts out to the seniors. Thank you, Vanessa. Sarah, I only get my nails done and has it because I was too smart to close them. I don't know what that means. Are more cases of COVID-19, of cases people getting it, or has it dropped? We're still going up in cases. Michelle, thank you. April, thank you as well. Okay, here, Dr. Levette says she wrote an open letter to seniors detailing plans for later. Her letter will be posted on Superintendent Dr. Ann Levette's Facebook page tonight. So here it is. You got the, you got it. Here it is. She's saying tonight on the Superintendent Dr. Ann Levette's Facebook page, she is going to drop, that's the word us young people use. She's going to drop her letter to seniors. So keep looking for that. And when she posts it, I will post it on my page as well. But go to Superintendent Dr. Ann Levette's Facebook page. Oh, Pastor Godson, thank you so much. I appreciate that. Appreciate the opportunity to talk with you. Cucumber water by Smart Water is good. I will try it. Sheila, I'm going to do my best to keep you safe. Renee, thank you very much. Jessica says her boyfriend has helmet hair going on now. Very proud of how I'm handling this. Thank you, Molly. I appreciate that. Christina, go for governor seat. Look, Christina, I just want to be the best mayor I can be. Jay, that's another good point, too. I want to talk about that, too. And unemployment, I want to talk about that, too. Have all the seniors send a picture and promo, pomp and circumstance be played in the background. Again, we'll wait for Dr. Levette's letter to drop. Is the county being left out of the enforcement and strategic plans? No. As a matter of fact, I think the county, through the Chatham Emergency Management Agency, we coordinate all that together. Casing, keep the county closed. Thanks forever, Dr. Polite, Savannah High class of 95, okay? Miss Bonaparte, thank you. Connie Roundtree, thank you. Sheila Jinx Odom says Romans 13, 1 and 2 says, those who refuse to obey the law of the land are refusing to obey God. Okay, what about dogs? Can they get it? I've heard that a tiger got it. I'm not sure about dogs. Dr. Levette, 4 people curbside, that's crazy. As long as we have it in our car, it shouldn't matter. Aisha, it does matter because the law says you can only have a certain number of people in a particular area. So, you know, we don't want y'all showing up with limousines and Sprinter vans and all that stuff. Dr. Lewis, good to see you. Sherry Butler, can we get some TV time to air graduation class recognitions per school? I think that's in Dr. Levette's plan. We have to wait for her letter to drop. Let's wait for her letter to drop, and then we'll go from there. Tanya, thank you so much. Nia, can they open a dog park? Not at this time, because you know y'all won't act right. I mean, y'all will be gathering, so not right now. Ms. Chauncey says that parents or graduates can celebrate at home. Deborah, thank you for tuning in from Hinesville. Is it possible that the May 1st deadline? I don't think May 1st is reasonable to me. Ms. Gladys, thank you. I don't think May 1st is reasonable to me. I mean, to me, June 1st is probably the earliest that I would be looking at. Faye, what about the kindergartners? Again, y'all need to wait for Dr. Levette's letter to drop. Lori Lewis says WTC has a great interview with BBO, Ms. Ball Oliver, graduation plans. Why are the emergency funds taking so long for businesses? Because they ran out of money, Jackie. They ran out of money. There was $330 billion, and they ran over that over just a week. And what does Ruth Chris doing and other restaurants need to do in order to get that quick relief? That's a federal question. I don't know. Let's see. So what was this live about? A bunch of stuff, Tori. I have to get you later. I'm not going to say period, Pooh. Y'all made that viral. Vita, love you too. Erica, hello. Can I take over Poola? No. Gregory, I know you want to work, but man, look, I want you to be safe. I want you to be all right. I mean, I don't want you to be able to work and die. I mean, does that make much sense? Let's see. Thank you, Christina. Thank you, Gloria. Students to go to private school, that's up to the private school. The private schools are going to have to make those decisions. How long sanitation will have to work with just driving one person because our routes are big and it's overworking them? Look, we were trying to protect our sanitation workers who were saying they were scared of catching the virus. So we dropped it down to 2 people per truck. That is what our sanitation workers said they wanted because they were so scared of working 4 to a truck. So we made it 2 a truck. So that's where we are. We'll be there as long as we need to be there. We need to be there until this passes. When this passes, we'll start working people back 3 and 4 to a truck again. So, I mean, you know, it's not overwork because not only are you working and getting paid, you're also getting $2.50 per hour hazard pay. So it's not overwork. You know, some people will be blessed to want to work right about now. I mean, some people want to work and can't work. So, we know. We're doing the best we can. Yolanda, do we think school will resume in August? That's a Dr. Levette question. Let's wait for her letter to drop. Denise, thank you. Thank you, Tia Acker. Thank you, Avis. Thank you. What am I going to do about all the people at Forsyth Park? Sylvia Roberts asked. Again, we got something for them. We got something for them. I show Walmart love. Now I need to show Kroger's on Gwinnett some love too. I go there sometime. Y'all take too long. I mean, I get in Walmart, hit it right back out. If I go to Gwinnett, I mean, y'all got lines and stuff. So I'll shout out Kroger on Gwinnett. I'll shout out every Kroger. Hello, all the Krogers, showing you all love. Um, Thank you, Jackie. Thank you, Tanya. Thank you, Candace. Oh, Candace, you got the email. Thank you so much. And again, we appreciate the Coastal Health District for what you're doing. Jasmine says, please say period poo. That was so funny. Yes, Stacy, I understand that the youngest male death here was 37 years old. Thank you, Shirley, for keeping me in your prayers. Darian, thank you so much. If Kemp starts phase 1 May the 1st, will Savannah follow suit? I don't know. The science has to say it. Now, Gregory, you say you'll die trying. Man, come on, man. You got to get this money, but this will be money that you get that your family will bury you with, man. I mean, you got to get the money, but I mean, are you saying then that getting the money is more important than your health and the health of your family? I mean, I understand the money issue, but on the other issue, on the other hand, we're talking about you being able to work for much longer than this. Sharice, I don't know what the CDC is saying yet. Thank you, Priscilla, for what you're saying. Condoleezza Coleman, thank you. Patrick, no, I don't want to be governor. And the hotels are still open. Oh, Dr. Levette says planned date for school to start is on track. But again, it depends on what's happening out here. Marquis says you're running for mayor next term. Come on and get it. So, two things I want to talk about, and then we'll let it go. The first thing is about unemployment. And I will be reaching out to Mark Butler, who's a labor commissioner. We've had a lot of people here from Savannah that have called and tried to file for unemployment. And just to be frank with you, I mean, we have seen the biggest unemployment spike probably in our remembrances in modern history. It's just so much unemployment, so many people calling. The offices are closed, so it's overwhelmed their offices. So I'm going to call Mark Butler to see, at least for the people in Savannah, is there some way we can help? Can we provide computer space? Can we provide places for their folks to work? Can we provide, maybe some place where you can walk in and have a glass partition so we can get people on these on track to receive unemployment? I don't know whether it's going to work or not, but I do want to call Commissioner Mark Butler to say, hey, my folks need to get that unemployment, and they need to register for unemployment, and what can we do to help that to happen? So I will be doing that. And for those of you who have been finding out a lot of issues about filing for unemployment, keep on trying, keep on pushing. If it's online, try in the middle of the night. Wake up at 2 o'clock in the morning and try to do it. Oftentimes when the volume is down, it's usually a little bit easier to get in. And then finally, we know that some people go to work to get away from home. And therefore, for someone who is in a violent or abusive relationship, home is the last place they want to be. When you have people who are frustrated and upset about other things going on, they often take out that frustration on their spouse or on their children. Because schools and other types of facilities are closed, our mandated reporters, people who are trained to see and or report these things, they're not seeing the kids. They're not seeing the spouses. And to be very clear with you, there's some abusive women out there too. It's not just men. It's not just women who are abused by men. Men are abused by women as well. So again, we will post some information about that to make sure that there are numbers that you can call. There are social service agencies that are out there willing to help you. You should not be in an abusive relationship. Love should never hurt. And if you are in an abusive relationship, if you know of someone in an abusive relationship, if you know children in an abusive relationship, we'll put some numbers out there, or you can call me. We will find a way to get family members some help. This is the last thing that they need to be abused in a time such as this. And our community won't stand for domestic violence. We won't stand for child abuse in this community. April is Child Welfare Month or something along those lines. So we want to make sure that we're very clear that we are taking care of those that are in abusive relationships. And abuse is not always hitting someone. Abuse can be emotional. Abuse can be stalking. And we want to make sure that you are you're safe. So, we'll put that information out. Please feel free to call it. Please feel free, again, to contact my office. If you're in an abusive relationship, I'll make the call for you. We want you to be okay. We need you to be okay. And if you're listening to this, and you know what abuse is, you know what abuse is. You know if if hands are being put on you. You know if you're being emotionally abused. You know if you're being verbally abused. That's not love. It's not. So therefore, if that's the case, let us get you the help that you need. Okay? And also for our young people. We have to do what we can to protect you during these times. So, wait a minute. There was something. Let's see. Why is this virus only attacking only blacks and not whites and Mexicans? Ms. Rivers, that is not correct. Matter of fact, in Chatham County, we're about 50% white, 50% black. It affects everybody. Viruses do not know particular names. Now, because of health disparities and socioeconomic disparities, there are people who are suffering more than other people. Shania, what about the jailhouse? Again, I don't know anything about the jailhouse. You have to contact the sheriff. He has, though, put out press releases about what's happening about that. Jacqueline, the areas affected the most, we're really not sure because we're trying to get zip codes about that. Can you love this more than once? Domestic violence was your doctoral research topic. It is real. Thank you, and congratulations, Doctor. I'm trying to find you. Dr. I lost you. I saw you. Congratulations. Children leave love. Pay your bills. Yes. Stay healthy. Take care of each other. We will still get through this. We will. I get up every morning and say, you know what? If I can put my feet on the ground, I'm going to be okay. And you're going to be okay. No, the numbers here are 174 cases and 5 deaths. We'll get past this. We will continue to persevere. I promise you that as long as where I am, I'm going to do everything I can to protect the city of Savannah. That includes speaking truth to power, because you didn't send me to be scared. If people have issues with that, it is what it is. I'm very clear that my responsibility is the 146,000 folks that call Savannah home, and to those businesses that call Savannah home. I'm going to do everything I can to make sure that we're safe. And we're not going to rush this thing. We're not going to rush it. We are going to keep the faith. We're going to follow the signs. That's what we're going to do here. So thank you all so much. I know the weather's been beautiful. Please take the opportunity to go outside, but please continue to social distance. Keep me in your prayers. We're going to be okay. We're going to make it through this. We will talk about this soon in the past tense and talk about how we survived Corona. We are bigger than Corona. And we know that there's a God who's bigger than everything. We know that. We trust that you're going to be fine. Again, make sure you like my page. Make sure to share this video. And then Tomorrow I have an update coming out at 8 o'clock. I'll be doing my update at 8 o'clock. Dr. Levette's open letter to the seniors, to the class of 2020, that will drop tonight. Wait for it, and then she will be explaining what will be going on with the class of 2020 for the public school system. The private schools, they have to do their thing individually, and I'll start thinking about what we could do here. Like I said, I might just do a live and just let folks post pictures of their graduates, and we'll figure something out. Again, just to show love for our young people. All right. So thank you. God bless you, and we will be fine. So on behalf of me and my bottle of Nestle Lemon Splash, have a good night, and we'll see you soon. Thank you.